Very warm welcome to all the NEETPG aspirants. Today we are going to discuss about this important topic, which is DDH. So DDH is basically developmental dysplasia of hip. It was earlier known as congenital dislocation of hip. And for test in DDH we have total of 5 tests which are performed at a specific time of the age of the infant, and we also have a question of the day at the end. So we are going to discuss the topics one by one. Okay, so the first test which is there, so we are going to discuss two tests collectively, which is Barlow's and Ortolani. Both of these tests are performed when the infant is less than 3 months. So B for Barlow, B for bad. So why is it bad? So because the physician is going to dislocate a dislocatable hip, and this will lead to crying of the baby. So what he is doing is, physician, the maneuver which is performed during Barlow's is adduction. So due to adduction, the femoral head goes out of the socket and the baby cries. So this is Barlow's. And your Ortolani is opposite of Barlow, where the maneuver performed is abduction, where there is relocation of the dislocated hip. Okay, so this was Barlow's and Ortolani. The next sign which is performed by during 3 months to 18 months is Alice or Galeazzi sign or test, and this is to be done to detect the unilateral hip deformity. So as you can see in the image here is that, so when the patient which is there, he is supine and there is flexion at the knee and hip, you see that during this position the DDH hip which is there, it is there is going to be posterior dislocation of the hip and the limb is going to shorten. So this part which is there, this left hip which is there is dislocated, and hence it is below the line of the normal leg. And as you can see, it only detects the unilateral hip dislocation, whereas now here we have a test which detects bilateral hip DDH, and this is known as Klesig's test. So in Klesig's test, we are what a physician is doing is, he is taking two fingers, one at your index finger and other is the middle finger. So index finger is placed at anterior superior iliac spine, whereas your middle finger is placed at the greater trochanter. So we take a line passing through this point, perpendicular line passing through it, and normally it crosses the umbilicus, whereas in a dislocated hip it goes down. So your greater trochanter is pushed down due to dislocation, and the line passes below the level of umbilicus. So this is umbilicus, so the line is passing below the level of umbilicus, which is abnormal side. So you can perform it on the bilateral hip, and hence you can detect the bilateral hip dislocation. So now till now we have discussed about Barlow's, Ortolani's, your Alice or Galeazzi, and Klesig's test. Now we have a different sign or test known as vascular sign of Narath. So basically vascular sign of Narath, what is the principle behind is that we palpate our femoral arteries against the femoral head. So when the femoral head is dislocated, there is inability to get the pulsations of femoral artery as the hip is dislocated. So this is positive in your DDH or any condition where the femoral head is going to be dislocated or it is going to be deformed. For example, avascular necrosis of femoral head. Apart from that, so we have these 5 tests, and the interesting point is that DDH is very less common in Indians and it is more common in Western, due to this practice that the posture of the baby which is there during his infant period is that your legs are abducted, and due to that the femoral head is proper into the acetabular socket, and this prevents the further formation of DDH. Now we have a question for you. So what is the screening test for DDH and investigation of choice of DDH? You can put your answer in the comment section, and also you can suggest us any further topics so that we can keep those topics into our subsequent videos. Okay, thank you.